Welcome to the Egg Whisperer Show, a podcast exclusively designed to create more reproductive health awareness and discuss your fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
Hi, everyone. Welcome to the Egg Whisperer Show. Today's topic is everything you need to know about pregnancy after IVF. I have Dr. Jie Deng on today's show. Hi, Jie.
Hi, how are you, Dr. Amy? Nice to see you.
Awesome to have you on today's show. Dr. Jie Deng joined Stanford University Fellowship Program in July 2018. She graduated from medical school in China, where she received her MD and PhD. She came to the U.S. in 2008, where she was awarded a California Institute of Regenerative Medicine training grant and worked in the field of stem cell research at UC San Diego. She then did her OBGYN residency at Wayne State University and then trained as a maternal fetal medicine specialist at Yale University. She has been interested in and actively involved in scientific research, publishing articles in fields of genetics, epigenetics, and stem cells in journals like Nature Genetics, Nature Method, Genome Research, Stem Cell, Stem Cell, and Molecular Cells. Thank you for being on today's show. I'm so glad you're here because we're going to talk about some of the questions that you guys all have. And I get these questions all the time. And so there's no better person than you because of your background to answer. So let's get started. Here's one question that everyone asks. What's the pregnancy risk for women over age 40 to 45?
Yeah, we get that question quite often. So when women is beyond age 40 or 45, and because at that time, our ovaries just do not produce eggs with fascinating quantities. So they will have increased the risk of having a baby with normal chromosomes or having higher risk of miscarriage. So at age 40, the chance, let's say, for example, to have a baby with Down syndrome is about 1 in 100. And at age 45, that chance will increase to 1 in 25.
Wow. Yeah. And then as far as how they conceive, does the chance change based on the treatment or is it about the same?
So if they conceived by using their own eggs, then as we just discussed, they will have those increased risk of miscarriage or having baby with abnormal chromosomes. But for women who's over age 45, then the likelihood to get pregnant with their own eggs are very small. So many women will use donor eggs to get pregnant. So with donor eggs, the age-related genetics are of the donor. So let's say if a 45 years old woman is carrying a pregnancy from a 30 years old woman's donated egg, the risk of a Down syndrome is that of the 30 years old, which is only 1 in 800. So in that case, the chance to have a chromosome abnormal baby is low.
And that's great because that just tells women out there that you can have a baby. I saw something funny on Instagram. That was a really cute picture. It said, all juice, no seeds. And the thing is, you don't need the seed to be, I'm not good at these analogies, but you know what I mean? And so you don't have regular periods to have a healthy pregnancy. There are things that doctors like us can do to help your uterus grow a beautiful lining so that you can use a donated egg and still have a healthy pregnancy. And this can be for women over 40. But I want you to tell us, because this is a question that I know your patients get too, is what are the particular risks for these women related to pregnancy that they might see, especially if they're over the age of 45?
Exactly. So regardless of how women conceived, either naturally or using IVF, donor eggs, beyond age 40 or 45, they have increased the risk of certain specific medical conditions. For example, they will have twofold greater risk of developing gestational diabetes or hypertensive disorders or preeclampsia compared to younger women. It may not always be the woman's age that caused the problems, just because as the older we get, we have conditions like diabetes or hypertension more frequently. And these health issues just magnify with pregnancy. Also, advanced age appeared to shorten pregnancies. For mothers who are 45 years or older, more than 1 in 5 delivered their babies at less than 37 weeks pregnancy, and compared to only 1 in 10 of all women. And in 80% of women in this age group, delivered their babies by cesarean section, which is more than twice the overall rate.
Yeah. I mean, I think that's a great point for people to hear, because when women come see me and they're 50, they look amazing, right? Exactly. They look so healthy. They're here to have a baby because they've taken really good care of themselves and they think of themselves as young enough to do so. And I agree with them, but the uterus doesn't behave the same way. So the way I think about it is every pregnancy is natural. As soon as you put that embryo in, nature takes over, and so is every delivery. But sometimes you need to perform a C-section. It doesn't mean mean that you're less of a woman or anything like that if you have to do that. It's just more related to what's going on with your uterus, and women should know that up front.
Exactly.
So if you are someone who's, let's say, over the age of 40, how, or even 45 or 50, how should you plan for pregnancy? What should you do to prepare?
Yeah. So I would say prior to conception, they want to work with their primary doctors to manage chronic medical conditions such as hypertension or diabetes to just get in the best shape possible. And oftentimes their doctor might refer them to a maternal fetal medicine specialist who will assess their medical condition, review the safety data of any medication they might be on to see if the medication is safe or not to take during pregnancy. Oftentimes, we want to get an EKG to check their cardiac function because during pregnancy, the heart has to work harder to adapt to the change of pregnancy. So let's say if someone has marginal cardiac function in the non-pregnant status, she might not be able to tolerate the added stress of the pregnancy. So work with their doctor and basically stay as healthy as they can. And make sure to take prenatal vitamins with folic acid, quit smoking, taper down the amount of alcohol intake, and keep as close to your ideal body shape as possible.
And is there any particular extra care during pregnancy that they should be getting or asking for? Because again, it's like one of those things, you look so good and sometimes your doctor forgets your age and sometimes these things can be missed. So what are the things that patients should make sure their doctors are doing while they're pregnant?
Yes. So once they get pregnant, both genetic screening and the diagnostic testing, for example, non-invasive prenatal testing or chorionic villi sampling or amniocentesis, those things can be done to make sure the chromosome of the baby is normal if the woman wants to find out that information.
If a woman has done PGTA or the genetic testing of the embryo, does she still need some of those tests, the genetic tests that you mentioned, like CVS?
That's really a great question. So the answer is yes, because pre-implantation genetic testing uses only a few cells from the early embryo. And a misdiagnosis is possible, although it's not common. And the American College of Obstetrics and Gynecology did recommend that all patients who have had pre-implantation genetic testing still should be offered traditional screening and diagnostic testing for chromosome abnormalities.
And what about ultrasound? I hear some OBGYNs requiring my patients to have a fetal echo and others don't. What does the data show? Do all women who've had an IVF pregnancy need that?
So actually, that's recommended because there's a higher chance to have a congenital cardiac anomaly, like in IVF the babies. So that chance overall is 0.5% in general population, but in IVF pregnancy, that doubles. It's 1% in IVF pregnancies. So that's the reason we recommend fetal echo, like to all IVF pregnant women.
Is there anything else on this checklist that women should know about so that they're making sure that their doctors are doing this for them?
Yeah, so they might need early glucose screening testing based on their family history, personal history, or like their body weight. And they will be closely monitored for high blood pressure and preeclampsia. And sometimes if they have any medical issues or concerns in second or third trimester, they will need additional ultrasound to monitor for baby's growth because low birth rate is another pregnancy complication that is more common in this age group moms.
And I imagine low birth weight is also more common in twin pregnancies. And I'm sure you get this too. I mean, I have patients and it's, of course I get it. Like they want a 2-for-1 or they want a twin delivery or a twin pregnancy. What are your recommendations around that?
Yes. So I would say twin pregnancy is associated with almost all maternal and neonatal complications, except a big size baby, because these babies are likely to be born prematurely. Only like 40% of twin pregnancies go full term, and the prematurity can lead to a number of problems. The baby might need respiratory support or feeding support because of immature lungs and the GI system, and also depends on the gestational age at birth. Babies who survive extreme prematurity are at risk for long-term effects. For example, cerebral palsy, developmental delay, vision problems, or hearing loss.
And I think that's important for people to hear because a lot of people know patients or know friends who've had twins, but they don't necessarily know the twins that have these problems. And
Exactly.
So I hate being that negative person bringing that stuff up with people, but I think it's so important for people to know before they make the decision to transfer 2 embryos.
Exactly.
Another question I get a lot, and I'm sure you hear this too, and I'd love for you to address this, is IVF with ICSI, does it really cause congenital anomalies or birth defects the way that it reads in the IVF consent forms that patients have to sign?
Well, it's such an important question, but I think it's not easy to answer that question. Although most pregnancies conceived by IVF or ICSI had healthy outcomes, there have been some reports of increased risk for birth defects in babies conceived with IVF or ICSI. However, these studies and findings have not been consistent. So in 2016, CDC used the national ART surveillance data and linked with information from vital records and the birth defects registry for 3 states: Florida, Massachusetts, and Michigan, and studied assisted reproductive technology and birth defects in 4 million infants. And the data from this large population showed that if we don't look at birth defects that are associated with abnormal chromosomes, the overall defects chance to have non-chromosome defects was only 5.8 per 1,000 for ART infants, which is slightly higher than 4.7 per 1,000 for non-IVF babies. And babies conceived by using IVF were more likely to have congenital defects such as cleft lip, cleft palate, or congenital heart defect. And in addition to the structural birth defects, some evidence links IVF to 2 genetic diseases, Beckwith Weinman syndrome and Angelman syndrome. However, we don't know whether these outcomes are due to IVF ICSI treatment or whether it's due to the inherent problems that lead to the couple being unable to conceive naturally. Yeah. And also we need to realize that absolute risk of having these defects are very low. For example, even IVF babies have 10 times higher chance to have Beckwith Weinman syndrome. The chance will still be 1 in 1,300. Of course, these findings deserve more research attention, but based on observed data, IVF and ICSI is considered safe and does not have much greater risk than those of natural conceptions.
Yeah, I mean, I think that when you Google this kind of stuff, it's hard to know what to believe. And so it's so important for us as 2 doctors putting this information out there so people who are scared about what they're reading online, they get the real data, the real numbers, so that they can make their decision as to whether to do treatment or not based on information that's accurate and true and not the bad stuff. So along with the birth defect, question is also intelligence of babies. Are IVF babies not as smart or smarter? I'd like to think, but that's one question I get. Would ICSI affect the intelligence of offspring?
Sure. So because ICSI procedure involves more manipulation of egg and sperm and give the potential stress of such handling. So there have been concerns about this procedure, even though many of them are theoretical. As we just discussed, nowadays, many follow-up studies switch their focus to the developmental outcomes. Although several early studies with small samples suggested increased the risk of mild developmental delay, 2% in ICSI baby versus 1% in natural conceived children at 1-year-old age, data from many larger studies did not show difference in developmental outcomes when compared to the general population. For example, studies from Denmark examined the academic performance in over 8,000 children conceived by ART, and they confirmed that these IVF-born babies are just as intelligent as their spontaneously conceived peers. Not super kids, but certainly not worse off. And this was supported by many other multi-center studies in which children's development and behavior at 5 years old and 10 years age were studied. Also, some studies showed that the chance to have autism in children born with ICSI is not significantly higher than naturally conceived children. So I would say, based on data we have so far, ICSI procedure itself did not show to affect the psychological well-being, IQ, or cognitive development of children.
Yeah. I would say that my patients are going to disagree. I think they do think their kids are super children. So how about medical health? Because we talked about birth defects, we talked about intelligence, but this one thing that just keeps popping up online is cancer risk in babies born from IVF. Can you talk to us a little bit about that too?
Yeah, sure. So just use the most recent article published in December last year. That paper basically used the data from more than 1 million children in Denmark. And they suggested that there was increased risk of a childhood cancer after frozen embryo transfer. And after that study was published, many internet articles you can imagine appeared with alarming titles such as "Freezing embryo doubles risk of IVF kids developing childhood cancer," or like "Children born with frozen eggs twice as likely to develop cancer." So this did cause a lot of anxiety from an infertility patient who had children with frozen embryo transfer or is planning to get pregnant with frozen embryos. And just 3 weeks ago, one article published on Journal of Assisted Reproductive Genetics pointed out significant flaws in the methodology and the interpretation of that study. So basically, when you use a large sample database to do data mining or data fishing, some dubious findings will turn up. You might find some things that shows statistical significance, but these findings might not be valid due to misinterpretation of data or might not translate into clinical significance. For example, in that study, women who conceived through frozen embryo transfer were compared with those who conceived spontaneously. There's so many confounding factors and a bias between two groups, which differ not only in the usage of frozen embryo transfer, but also like distribution of parental age, diagnosis of infertility, use of infertility medications, etc. And in order to prove an association between IVF and childhood cancer, ideally, we would hope to have two groups of children who are identical in every feature, except the utilization of IVF. However, you can imagine it's impossible to find such a control group in which children were born naturally by infertile parents. So it's almost impossible to confirm the association between the IVF technique with those outcomes. And also, there's no evidence in animal studies suggested frozen embryo transfer would increase the risk of childhood cancer as well. In addition, when we consider the clinical significance of these findings, for example, due to the very low absolute childhood cancer risk, hundreds or thousands of frozen embryo transfers would have to be avoided in order to prevent one case of cancer. And there are numerous benefits of frozen embryo transfer, such as providing the opportunity for embryo banking and pre-implantation genetic testing, decreasing the risk of ovarian hyperstimulation syndrome, and improve clinical pregnancy rate in some populations. This cannot take away frozen embryo transfer because of this small dubious risk. Of course, we might be limited by knowledge we have today, but so far, I would say there's no good evidence supporting an association between frozen embryo transfer and a childhood cancer.
That goes along the lines of what people read, that if you do IVF, you're going to have a baby with a higher risk of birth defects, your baby's going to have cancer. And so I'm so glad that we can talk about this and say, you guys, don't believe what you read, because we have really good data to show that that isn't something that should prevent you, or that fear from using IVF to grow your family. So I'm glad we're able to talk about that.
Exactly.
So the other thing that I get asked a lot is, I'm putting all these hormones in me, Dr. Amy. Am I going to give myself cancer? So does IVF treatment increase one's risk of breast or ovarian cancer?
Yeah, we get that question very often. So studies in investigating breast cancer risks in women who underwent IVF treatment are not consistent. Most studies do not show an overall increase of breast cancer in exposed women. In 2018, there was one study linked the data of 2.2 million person years of observation and the risks of ovarian, breast, and uterine cancer in women who had a treatment with assisted reproductive technology. And no increased risk of uterine cancer or invasive breast cancer was detected in women who had assisted reproduction. They observed increased borderline ovarian tumor, but when they broke down patients' characteristics, they found that increased risk of ovarian tumors were limited to women with endometriosis or low numbers of children or both. And also they found no increased risk of any ovarian tumor in women treated because of only male factors. So which suggested that ovarian tumor risk could be due to patients' underlying health problems rather than assisted reproduction itself. Yeah. And for patients who were diagnosed with breast cancer, data showed that egg freezing or IVF treatment did not worsen the prognosis of cancer or result in relapse of cancer. Of course, due to the theoretical concern that high estrogen level during the IVF treatment can potentially stimulate cancer cell growth, we do use some medication, for example, letrozole, to lower the estrogen level during ovarian stimulation, especially for those patients who have estrogen-dependent breast cancer. But overall, IVF is considered safe. And for breast cancer patients who need chemotherapy, they should not avoid a fertility preservation because of the fear that IVF treatment will make their cancer worse.
Well, thank you. I mean, I really appreciate your very careful analysis and talking to us in a way that we can all understand. I'm going to put this all out in an article with links to the different studies so you can read directly and learn more. And I'm sure that following Jie on Instagram or Dr. Deng, I follow her and I just feel smarter doing it. So where can patients find you?
They can find my Instagram, Infertility, Dr. Deng. Yeah, I'm all with them.
Yeah, awesome. Well, thank you so much for all your work, all the research you've done, all the publications, everything that you're continuing to do to make it easier for women to do IVF and feel really good that what they're doing is safe. And thank you for all this information you've put out there for us.
Thank you so much for having me here today. Thank you.
You're welcome. Bye, guys. Well, have a great night. I hope you guys really enjoyed today's show, and I can't wait to see you guys next time. Have a great day.
Thank you so much for listening and making the Egg Whisperer Show a part of your weekly routine. To find show notes and a full transcript for this episode, visit dramy.org and look under the blog tab. While you're there, you can find a link for the Egg Whisperer newsletter, which keeps you in the know about fertility news. You can also find Dr. Amy and the Egg Whisperer Show on YouTube, Instagram, or Facebook. If you'd like to learn even more, Dr. Amy offers classes at the Egg Whisperer School, eggwhispererschool.com, or you can request a consultation on dramy.org. Thank you so much for tuning in and for sharing the Egg Whisperer Show with others. Keep sparkling and have a great day.